everyone, it's Sarah
and Ben with RegisteredNurseRN.com, and in this video,
we're going to talk about the top 15 myths about the nursing profession. Let's get started. Myth number 15, nurses just clean up, poop, and pee all day. This is simply a myth. Many people think this. Whenever I was in nursing school, one of my friends was approached by an older gentleman who asked her what she was going to do with her degree. And she said, I'm going to be a nurse. And he said, you mean to tell me you went to school all that time just to clean up poop and pee? And she said, I was dumbfounded. And she said, that's not all I'm going to do. As a nurse, we do so much more than just do that. We give medicines, we change wounds, we assess and care for patients, we educate them where they're advocates. We do so much as a nurse other than just clean up poop and pee all day.
myth number 14, nursing is sexy and glamorous. This myth and stereotype is everywhere. It's in movies, it's in popular culture. In fact, if you go to the average Halloween store, what does an outfit for nurses look like? Well, it's a super skin-tight white outfit with the low-cut shirt and the really short mini skirt, right? Where does this idea come from? Nursing is not about being sexy and glamorous and beautiful and all this nonsense. Now, I'm not saying as a nurse you can't be beautiful or attractive, but the thing about it is, nursing is about being selfless. You're supposed to help patients. It's not about you. In fact, here's the raw truth of the matter. On most days, you may go into your shift looking something like this, but you'll probably come out looking something more like this.
Myth number 13, you can't be a nurse if you're shy or afraid of blood. There are many nursing specialties where you do not deal with blood or social interaction. For instance, case managers rarely see blood, and nurses who work in informatics or research, they barely even have social interaction. So if you have these issues, there are areas in nursing that you can work.
Myth number 12, men do not become nurses. This is simply not true. More men than ever are entering nursing school and the nursing profession. And even if the idea of being a bedside nurse doesn't appeal to you as a man, the fact of the matter is there are a lot of areas within the nursing profession that you could work. For example, some men like being nurse managers. Some may work in nursing informatics where they deal with technology or programming. Or some may go on to graduate school and become a CRNA, a Certified Registered Nurse Anesthetist, which earns a pretty competitive salary, by the way, where you do work like an anesthesiologist does. Or you could even become a nurse practitioner, which has a lot of the same duties as a doctor. So there are plenty of areas within nursing for men.
Myth number 11, nursing is a safe job. Nursing certainly isn't the most dangerous job in the world, but it does have its risks. As a nurse, you're coming into contact with superbugs like MRSA, VRE, recently Ebola, and C. diff. Also, as a nurse, you use needles in order to stick patients, and you're going to be coming in contact with HIV, hepatitis. So there are definitely risks that you are exposed to as a nurse.
Myth number 10, all nurses work in hospitals. It's true that a lot of nurses do work in hospitals, but there are so many other areas of nursing where you can work. For example, school nurses don't work in hospitals, they work in schools. Nurse educators or nurse instructors, they work in colleges usually. And in fact, there's a lot of nurses that work for the private sector and businesses, and nurses also work in travel nursing or home health where they'll go directly to the patient's house. So there are a lot of areas in nursing. Not every job is all about hospitals.
Myth number 9, all nurses marry doctors. This is a funny stereotype portrayed on TV and in the movies. While some nurses are married to doctors, majority of them are not. So this is simply a myth that is popular in our culture.
Myth number 8, all nurses do the same kind of work. While it is true that a lot of nurses do have the same skill sets, The fact of the matter is, nursing is one of the most diverse professions out there. For example, an ER nurse may have a fast-paced shift where patients are coming in and out and it's life and death every second. But in contrast, a camp nurse may simply work for an organization at a summer camp, and he or she may deal with patients and treat minor injuries. In contrast, a school nurse will help treat students and make sure their immunizations and so forth are up to date. So nurses do different tasks depending on the industry and specialty.
Myth number 7. Nursing specialties require specific schooling. Many people think that if they want to be a neonatal nurse, they have to go to like a special type of schooling to become that type of nurse. Or if they want to be a labor and delivery nurse, they think they need to go to that type of school. So the answer is you have to just go to nursing school. Then you'll be trained on the job in that specific setting on how to be those types of nurses. So there's not a specific school to be a specific type of nurse.
Myth number 6, you can only become a registered nurse if you go to school for 4 years. The truth of the matter is, you can actually become a registered nurse in as little as about 2 to 3 years through an associate's degree program. All you have to do is complete the 2 to 3 years of schooling, then pass the NCLEX RN exam, and boom, you are ready to go out and work as a registered nurse.
Myth number 5. RNs and LPNs do the same thing. This is simply another myth. RNs and LPNs do different types of skills. For instance, in some states, LPNs are not allowed to give blood or push IV drugs, but an RN can do this because this is within their scope of practice. So an RN and an LPN are different.
Myth number 4, once a nurse gets his or her license, they can't go and work in another state. While moving states can lead to additional paperwork and maybe even an application for another nursing license, many states actually operate under a compact state agreement, which allows you to work from one state to another without a lot of additional paperwork or hassles.
Myth number 3, an ADN nurse is different than a BSN nurse. Really, the only difference between an ADN nurse and a BSN nurse is their degree type. Generally, they both perform the same type of skills and they are both licensed registered nurses.
Myth number 2, all nurses work 12-hour shifts. While many hospitals and other healthcare agencies will require 12-hour shifts, the fact is there are a lot of areas of nursing where you'll work a more traditional shift. For example, if you work in a business, in a clinic, in a school, or as an educator, you'll work probably a more traditional 9-to-5 work week.
And the number 1 myth, nurses don't make good money. Nurses actually earn a really competitive salary, especially considering you can become a nurse in little as 2 to 4 years. According to BLS.gov, in 2014, the average salary was $69,790. Not bad.